Imagine your brain is an orchestra. Every movement you make, lifting a cup, tying a shoelace, even blinking, depends on timing. Now imagine the drummer starts playing in the wrong tempo. Not because you're lazy, not because you're weak, but because the wiring that keeps rhythm has started to misfire. And then a surgeon says something that sounds like science fiction. We can implant electrodes in your brain and tune the rhythm. Yes, electrodes in the brain. And today, it's not just on or off. The newest systems can listen to your brain signals and adjust stimulation in real time, like noise-canceling headphones, but for tremor. Welcome to Deep Brain Stimulation, a brain pacemaker that's learning to improvise. Before we talk technology, let's talk human, because DBS isn't really a device story, it's a control story. Let me introduce you to a very real kind of moment, experienced by thousands, even though this specific person is a composite. She's about to unlock her door. Simple, ordinary. But her hand says, absolutely not. She tries to write her name. Her signature looks like an earthquake report. And here's the part that really messes with your mind. Her brain is still her. Her intelligence still there. Her willpower still there. But the movement circuits are running bad code. For conditions like Parkinson's disease, essential tremor, and dystonia, DBS has become a major treatment option, especially when medications don't control symptoms well enough. And if you're thinking, wait, brain surgery sounds intense, you're correct. That's a healthy brain talking. So let's slow down and make this clear. What DBS actually is. So what is DBS? Deep Brain Stimulation is a therapy where doctors implant thin electrodes into specific deep brain areas, connected by wires under the skin to a neurostimulator, a pulse generator, usually implanted in the chest. Very similar in concept to a heart pacemaker. The device sends controlled electrical pulses that help modulate abnormal activity in movement-related brain circuits. For Parkinson's, common targets include the subthalamic nucleus or the globus pallidus internus. Now here's the key clarity. Say this slowly. DBS is generally a symptom treatment, not a cure. It can reduce tremor, stiffness, or movement problems, but it does not stop the underlying disease process. So DBS isn't a download the new brain update button. It's more like, let's stabilize the signal so you can live your life again. The rabbit hole, how the brain's rhythm gets tuned. Here's where it gets interesting, but I'll keep the trail visible. Think of movement like driving. Your brain says, go. Your body should obey, smoothly. But in some disorders, the movement network starts producing abnormal rhythms, patterns linked to symptoms. Traditional DBS is like setting cruise control. A doctor programs stimulation settings, and the device delivers that stimulation continuously or on scheduled programs, and it works. But brains aren't constant. Symptoms fluctuate. Medication cycles, stress levels, sleep, movement, time of day, which raises a powerful question. What if the device could adjust moment to moment based on what the brain is actually doing? And that is where adaptive DBS enters the story. Adaptive DBS, the big upgrade, it listens back. Adaptive DBS, also called closed-loop DBS, adds a crucial feature. It can sense certain brain signals and adjust stimulation automatically, within clinician-defined limits. So instead of one setting all day, it becomes the right stimulation at the right time. And this isn't just a lab idea anymore. In the U.S., the FDA-approved Medtronic's BrainSense adaptive DBS system for Parkinson's disease, announced February 25, 2025. This is the moment DBS stopped being just a brain pacemaker and started becoming a brain pacemaker with situational awareness. Not mind reading, more like signal reading. And very important because the internet gets dramatic. Adaptive DBS does not decide your personality, your beliefs, or whether you should text your ex at 2 a.m. That problem remains tragically unsolved. What it does do is monitor measurable neural activity related to symptoms and use that information to help tune therapy. Risks, limits, and what sci-fi skips. Now let's talk reality, because brain surgery has real risks. DBS implantation can involve complications like bleeding, infection, or device and lead problems over time. There can also be stimulation-related side effects, depending on the settings and target, such as speech issues, balance changes, or mood or cognitive effects in some cases. Clinicians usually manage these through careful programming, monitoring, and adjustment. And DBS is typically considered when symptoms aren't adequately controlled by medication or medication side effects become too burdensome. That's why DBS isn't a trend, it's a serious therapy for serious suffering, performed by specialized teams. The future and the ethics. Now zoom out. Adaptive DBS is part of a bigger shift. Medicine moving from average settings to personalized, responsive therapy. But it also raises real ethical questions. Who owns the brain signal data? How do we protect privacy? How do we ensure access doesn't become only for the rich? Because the future can be incredible and unequal at the same time. Still, here's the core human truth. For many patients, the miracle isn't futuristic. It's simple. It's drinking from a cup without wearing it. It's signing your name and recognizing it again. It's walking without feeling like your body is betraying you. And that is not science fiction. That is science applied with compassion. The takeaway, slow wrap-up. So today you learned DBS uses implanted electrodes plus a chest neurostimulator to help treat movement disorders like Parkinson's, essential tremor, and dystonia. It's primarily symptom control, not a cure. And the newest leap, adaptive DBS, can adjust stimulation based on brain activity. FDA approval for an adaptive DBS system for Parkinson's was announced in February 25, 2025. Outrow, Part 2 hook. If you want Part 2, I'll go deeper into what brain signals does adaptive DBS actually use and why those signals, because that's where the rabbit hole gets delicious. Like, subscribe, and comment. Do you think brain implants will become normal medicine, or will people always fear them?